Great. So we're just going to start off with a territorial acknowledgement. We wish to acknowledge the land on which we gather is the traditional and unceded territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. If anyone is joining from outside Vancouver, feel free to share in the chat. So just a brief overview of the agenda today. We'll go over the purpose of this validation session, validation of user position, location, encounter type and medical service, fax and printers, referral, appointment and registration, documentation and discharge. I anticipate we won't need the full hour and a half, given that this is a registration only clinic. Once again, introductions. I just want to thank everyone who's been a part of this clinic and for everyone's time today during this session. So the purpose of today's validation session is to review the completed clinic CST Cerner build and workflow for the VGH Dentistry Oral Health Center. So a lot of this will be a review of what we've discussed in previous sessions. So in terms of user position validation, the physician will be granted the position of physician dentistry. VGH clerks will have scheduling clerk work queue monitor 01. And it's been determined that the dentistry clerks, dental hygienist, and certified dental assistant do not require Cerner access at this. I should add, if anyone has any questions, comments, or concerns, feel free to interrupt as I'm going through.
Liz?
Yeah.
Sorry, study. The dental assistants often do pull up pathology reports and that sort of thing for us. Will they not be able to do this anymore?
Okay, so that is something to add. I don't think we had mapped them having access, but I think we can potentially have them have read-only access, so they're still able to do this.
Yeah, just read-only would be sufficient. And that would just be the dental assistants. The clerks don't need access. The hygienist does not need access. The assistants, and I presume the residents will also have full access, right?
Okay. Kimson, I see a hand.
Oh, hi. Just a quick question. Will the dental hygienists and dental assistants will they be doing the best possible medication history in clinic going forward?
Will they be doing? So I didn't hear the question.
He was just asking if they'll be doing best possible medication history.
Like taking a medical history, you mean?
Oh no, just gathering medication history and entering it into Cerner.
No.
Thank you.
Okay, Dr. Fonseca will follow up to ensure that the assistants have the required access so they can continue with the current practice.
Thank you.
So in terms of location validation, facility is VGH. The core short name will appear as VGH Dentistry, and the core long description is VGH Dentistry Oral Health Center. For encounter types and medical service, we've confirmed the medical service is dentistry. The majority of encounter types will be outpatient, and we have included phone consults and virtual health, but we understand that's quite a rare instance within this clinic. For fax and printers, we have the same fax number and phone number. There'll be no changes. There will be a printer and label printer within this clinic. No narcotic printer. Requisitions will be auto print to paper, and there'll be no SunQuest Collect or single document scanning. So on that note, if there's any documents, Dr. Fonseca, that you or the team would like uploaded into Cerner, they will need to be sent to HIM for scanning into the system.
Okay. Hmm.
So for referrals, the internal referral, the order name will be referral to outpatient VGH dentistry. There is no associated appointment type, as it will be printed and faxed directly to the clinic. And the location drop down will read VGH Dentistry Oral Health Center. So this clinic referrals will still be received two ways, internally or externally. And they will all be received via clinic fax. So your external referrals will continue as they have in current practice, and the provider will triage accordingly. And internal referrals will be completed in Cerner by the referring provider and will be faxed directly to the clinic. Next is just a screenshot of what that new internal referral order will look like. The location, again, it will be paper referral. And they will complete the referral and fax it to the clinic. This is hard to read, but it is the internal referral with that reference text that we built. And they will click on the little link here to access the form and print it out.
And that's
Here,
the same referral form that they would get online?
yes, that's the exact same one that you're currently utilizing.
Okay, thank you.
And this is just the reference text, a little bit larger.
Mhm.
Okay, next we'll move on to registration. So registration will continue to be completed by David's clerks. And it will occur the day after the appointment or when workload allows, as per current process. Clerks will access ClearDent and obtain the required information for encounter creation. There's a number of additional fields in comparison to PCIS registration, but we've confirmed with both David's clerks and the clerks at Dentistry that they are available in ClearDent to access that info. And as I understand, the information goes into a spreadsheet and then the encounters will be generated in Cerner. For your community patients, because they will be registering after the appointment, order entry will not be available for those patients during their visit. We just had a few questions in terms of registration. The first was, how frequently are patients seen due to accident or workplace injury in this clinic?
It's quite variable. Most of our accidents come through emerge, so traumas and that sort of thing. Workplace injuries, like, are rare.
Okay.
But we do see a lot of like sporting accidents, car accidents, like, bar accidents, those sort of things.
Right. Okay. The reason I ask is that this is one of the required fields for encounter registration. And I believe currently this is typically documented in the notes section in ClearDent. I wondered if there was a way for the clinic to flag this for the clerks doing registration, just so they're aware which patients have been seen due to accident or workplace injury.
I do think that information would be helpful for us, as well as like patients who have like open claims. And the reason I ask that is because A lot of our specialists, will not accept, these sort of referrals because they're so time consuming, and so they are expected to be done in the community instead. So it would be good information for us to have in advance.
Okay,
You know, like when people are looking for like, you know, reports to lawyers and stuff like that, that's not really something we would do here. We would be referring them to a private facility.
okay, I see. And then the second question was, as we've confirmed, all the data elements that are required for encounter creation are in ClearDent, but we were curious if there's a report within ClearDent that captures visit, primary care provider, referring provider, primary and extended insurance info, or if there's kind of an easy central place that's accessible for the registration clerks.
Generally, if we want a specialized report from that, we can make a request to ClearDent, and then they can generate one for a fee.
Okay, I see.
So if it is something we wanted, it's a request, they sort of like put it together for us, but it will cost the health authority. So I'm not sure if that's something they want to look into.
Want to
And
pursue.
it really
Okay.
wouldn't be, I don't know how accurate they could do it in terms of like reason for visit, because that will change, as well as primary care physician. Like they're not really patients of any physician, they're just patients of the clinic.
Okay.
And then primary or extended insurance info, that's also checked on a monthly basis, so I'm not sure how accurate it would be.
Okay. Any other questions or comments from anyone else on the call before I continue?
Is that a report we want to look into?
Yeah, I think just it may be worth having a discussion with the David's clerks and Pinky, Rebecca, that are involved in the registration to see how much time it may take doing it current practice going into ClearDent to see if there would be a benefit of having it in a report.
That might be helpful, because right now they do occupy one of our workstations whenever they need to do their statistics.
Right.
So it was literally a report that we could print and, you know, give to Pinky, and then they could do it at their own time, like whenever they had time. That would definitely increase efficiency for us. But like I said, there would most likely be a cost.
Okay. I think that's something we could certainly take away and see, yeah, the cost and how feasible this request may be from ClearDent. Okay, so message center pools, clinic inbox and clinic flag are not going to be utilized in this clinic based on discussions during design session. So the default label printing, at registration, nothing will auto print. And if labels will be printed through PM conversation, there'll be the option for one non-blood specimen label, the referral demographics label, and one patient form label. Next piece here is the refusal inbox. So as we mentioned in the design session, the refusal inbox is a mandatory build feature. Cerner has the function to refuse documents, results, or orders in message center pools. A refusal inbox will be created to support this process. And this allows encounter orders and documents to be sent from clinic to the wrong clinician to be sent from the correct clinician. So in terms of this refusal inbox, because the dentistry clerks will not be given Cerner access, we just wanted to verify if this is something that Pinky, Rebecca, your clerks could take on just monitoring the inbox at kind of a predetermined frequency.
Which inbox? I thought everything
So-
was coming to us by paper.
Yeah, so this is if there was order entry done on Cerner and for some reason it was sent to the wrong clinician. So this is not referrals.
Oh, okay. So which, would this be an inbox in Cerner?
Yes, that's correct. So it's a mandatory build feature. We don't anticipate there will be much in the way of kind of notifications in the inbox, but someone still needs to look at the inbox periodically.
And so you're asking if it's the art clerks or Pinky?
So it could be either a provider to review the inbox maybe once a week just to assess, or the clerks. It's essentially who you would prefer and think is the most appropriate to monitor this inbox.
I think the clerk would be my go-to, just because I know clinicians get busy and then they forget, and you know, if they're not on site or they're in the OR, I fear that it'll be forgotten and not checked.
Right.
So I don't know if it's something that their clerks can do when they are entering that.
Yeah. Pinky or Rebecca, do you think this is feasible to have one of your clerks check this periodically?
We can do it, but just like, it would probably be definitely periodically.
Okay. Dr. Fonseca, does that sound okay? It would be infrequent, but still monitored.
Yeah, that's fine. I don't anticipate us getting a lot of stuff in here.
No, I don't either, based on kind of the amount of orders that would be entered.
Mhm.
Great. So next we'll go through the workflow validation. This will be quite quick, given that essentially the majority of your workflow is unchanged on ClearDent. So as I mentioned previously, you will be receiving referrals internally and externally, all on the clinic fax. They'll be collected and assessed for completeness and given to the provider for triage as per your current workflow. Again, this is just a photo of the referral to outpatient VGH dentistry that clinicians on Cerner can access, where they can print out the form and fax it to the clinic. In terms of screening and triage, scheduling, appointment confirmation, and communication, this will all continue on ClearDent as per current workflow. For order entry, for orders to VPP sites for inpatient and emergency room patients, that can be completed on Cerner. Orders to non-VPP sites for emerge or inpatient will be ClearDent or paper requisition. And for community patients, both will be current process, ClearDent or paper requisition. Documentation again will be relatively unchanged to current process. So dental hygienist and dental assistant documentation will continue in ClearDent. Odontograms and procedure-specific documentation will continue in ClearDent. And then the providers have the option to copy and paste into notes in Cerner as you see appropriate. And then here's just a quick snapshot of the note types available in Cerner and if they distribute to Accelerus or Care Connect. And last piece we have is discharge. So again, encounters for this location will automatically discharge at midnight after they're entered. And the current workflow for dentistry clerks in terms of booking additional appointments, prescriptions being provided, insurance info and billing will all remain unchanged on ClearDent per current workflow. I know we've gone through that quite quickly. Are there any questions or concerns from anyone on the call? Great. So next steps, there will be clinic workshop and training at dates to be determined. Dr. Fonseca, this would be a time where I know you mentioned in design, it would be helpful for some demos or reviewing the pieces of Cerner with some of the providers. So this would be an opportunity to review anything for providers within the clinic. And as soon as we have those dates, we'll be able to share them. Otherwise, sorry, Kinson, you have a question?
Oh, sorry about that. I was just want to double check. Will prescriptions be on prescribed from ClearDent? Was that what was said?
Yes, that's correct.
Oh, I'm not sure if this was mentioned, but the enterprise workflow is for all prescriptions to be entered through Cerner. What was that mentioned before?
Yeah, so this, there was a decision with Lori that this clinic would just be a registration only clinic.
Oh, okay, gotcha.
And then the workshops that you mentioned, will those be group workshops? Will they be independent for the clinicians? The training.
The training, sorry, I didn't quite catch the last part.
Oh, for the training, will there be like multiple time slots for the training? Will it be clinicians signing up for a time that works for them? Do you have any information about that?
Yeah, as I understand it, they will try to make it flexible in regards to your availability. I don't know, Katie, if you have any other details.
I don't. Yeah, the workforce planning team will reach out to determine availability. So I don't think we have the exact dates yet, but there should be more info to come from the project management team.
Okay. And then do we have an anticipated go live date?
I believe the go live date is geared towards July 15th.
Okay.
And just not officially announced yet, I don't believe.
Okay, great. Any last questions or comments from anyone? Perfect. Well, if there's anything that comes up between the next time we reach out with those dates, feel free to send an email. Otherwise, thank you everyone for your time today. And we'll give you an hour back.
Great.
Thank you.
Okay, thank you.